Today, I want to share with you a revolutionary breakthrough in medicine that could change the future in the way we fight bacteria. But before that, I want to talk to you about the past. Remember a time when you were ill as a child? You were probably told about this simple model by your parents. A model described by Dr. Siddhartha Mukherjee, so simple that you could summarize in just 6 words. Have disease, take pill, kill something. The notion of this model is so well acquainted with us that we already know when we get sick, and this is largely due to the inception of antibiotics. Antibiotics has helped humanity in treating bacterial infections like no other medicine could prior to its discovery. For example, pneumonia, tuberculosis, syphilis, and more and more and more. Some say that the world's first antibiotic, penicillin, played a pivotal role during World War II by reducing the number of soldier casualties tremendously. Here, we refer to the model again. Have pneumonia, take penicillin, kill bacteria, and there you go, disease cured. And what I really want you to feel is that the impact was profound, and it is every bit significant today as it was 78 years ago. Even though antibiotics have demonstrated to be a vital ally in combating bacteria, over the past decade, they have lost their footing in our fight against bacteria. Why is that so? Like every other living organism out there, we only passed on the most vital traits in the process of natural selection, and so do bacteria. Through natural selection, bacteria have passed on antibiotic-resistant genes over many generations of growth and reproduction. It occurs like this. First, the bacteria gets in your body. Some of them can be drug resistant. Antibiotics will proceed to kill all of those who are not resistant to drugs. When a population of non-resistant bacteria has been mostly eliminated by antibiotics, the residual bacteria which are resistant to antibiotics will begin to flourish. They may even transfer the antibiotic-resistant genes to other bacteria, which is the reason why some bacterial infections get prolonged and worsen without proper medical attention. Mainly to our overuse and misuse, we have unintentionally stimulated the bacteria around us to be increasingly resistant to the very drugs meant to fight them. This signified the dawning of the antibiotic resistance crisis. Well, you may think, why not just avoid antibiotics? Simple solution, right? No, you thought wrong. There are many situations where antibiotics are mandatory. For example, in dental procedures for patients with cardiovascular disease or diabetes, because bacterial infection through bleeding gums can complicate their pre-existing medical conditions. Deep open wounds, and also invasive surgery. This is to prevent secondary infections post-surgery. Let me tell you a story of Matthew Amis. Back in 2012, Matthew, a father of 4 from Queensland, Australia, had a seemingly harmless sore throat. Nobody could have ever imagined that it would turn into a life-threatening infection due to antibiotics resistance. This resulted in the loss of all 4 of his limbs. Matthew was just one of the few fortunate ones who survived to tell the story. According to the Antimicrobial Resistance Report in 2018, there are at least 700,000 deaths worldwide due to antimicrobial resistant infections. Time for some scary data of deaths for comparison. Every year, cholera claims around 100,000 lives. Antimicrobial resistance currently at 700,000 lives. Road traffic accidents at 1.2 million lives, and finally, cancer, about 8 million lives. Worrying enough, it was projected by the World Health Organization that by 2050, antimicrobial resistance will claim 10 million lives every year, making it one of the worst health problems if nothing is done to counter this. Now, where do we go from here? It seems that the phrase is true, that we can never escape from our past, but all is not lost. Elizabeth Karp and her team at McMaster University may hold the key to overturning this problem. A recent study found a new group of antibiotics with a never-before-seen approach in eliminating bacteria. The group of antibiotics is called glycopeptides, and it is produced by common soil bacteria Streptomyces.
By isolating and purifying these glycopeptides, the researchers were able to extract two new antibiotics, a completely new compound cobamycin and the less commonly studied compound complastatin. However, to understand how it works, we must first understand the mechanism of conventional antibiotics.
Let me give you a scenario. In the midst of a peak hour train platform, someone sneezes. Achoo! Unknowingly, you walk into the sneeze cloud and a bacteria in a droplet enters through your airway and into your body. There, the bacteria finds themselves a new home. In your body, the bacteria grow and divide. 1 to 2, 2 to 4, 4 to 8, and 8 to more and more. When they have reached a certain population, they damage the body by changing the environment around them. The immune system senses these foreign bacteria and quickly sends our body's natural defenders like white blood cells to eliminate them. Some white blood cells consume the bacteria whole. However, certain types of bacteria can produce a capsule, which acts as a protective layer around them. This prevents the white blood cells to consume them. When you take an antibiotic, for example, penicillin, it disrupts this protective layer and exposes the bacteria. This allows a white blood cell to consume them. How about the newly found antibiotics? This may come to you as a surprise because the new antibiotics work by doing the complete opposite. They prevent the protective suit from being broken down.
The antibiotics first binds to the protective layer, preventing it from breaking down. Since the breaking down of the cell wall is crucial for cells to grow and divide, when the bacterial cells cannot do that, they cannot divide. Within a day, the bacterial cells will die. Yet, one important detail remains, whether it will cause bacteria to develop resistance like conventional antibiotics would.
The researchers used agar dilution, a commonly used technique to determine the degree of antibiotics resistance. This involves adding a specific type of bacteria and an antibiotic to an agar plate. But the most important result was that resistance to the new antibiotics was slow and difficult to develop. This finding is revolutionary and has brought a glimmer of hope to the seemingly hopeless antibiotic resistance crisis. What does this mean for us? The first direct impact is that this new drug can help reduce our reliance on current antibiotics. This will allow us to at least slow down antibiotic resistance, and by doing so, hope to decrease the number of usually fatal antibiotic-resistant bacterial infections. Thirdly, because this new drug works on a completely new mechanism, it opens up to a whole range of possible types of drugs to synthesize. This could bring about a change in the way diseases are cured beyond the study. Finally, this has helped us to realize that nature has still a rich but untapped source of medicine waiting for us to discover. Just like the new antibiotics which were synthesized by the very soil we step on, there seems to be more nature has to offer if we preserve it.
Although we are years away from finding out the true efficacy of the drug, as much more tests through clinical trials needs to be conducted, the new antibiotics makes up an exciting avenue for further research and development. This discovery has helped us take a firm foothold in the renewed hope in the fight against antibiotic-resistant bacteria.